Good morning, good afternoon, good evening, everyone. Thank you very much for joining us for our monthly webinar. I welcome everybody from wherever you're joining us from. We are delighted to have you and we are glad you could make time. Today we have an exciting webinar that is supported and brought to you by JSI. So we'll be hearing from the CHISU project as well as the Ethiopia Digital Health Activity. And I'm really looking forward to hearing the exciting presentation that they have put for us. Next slide, please. For those that I haven't met, my name is Rose Nzioka. I'm one of the co-chairs of the Global Digital Health Network. Thank you. So the slide that you have here is about GDHF 2023. As you all know, we have our annual conference every year in December. This year we have it on the 4th to 6th in DC, and we'll also have a virtual option. So this is to remind everyone, if you haven't registered, please do register. You have a link on the slides that will be shared after this webinar, so please do register. Again, also to remind you, for those that are attending in person, you do need to make your hotel booking. I know the negotiated rates that we had for the hotels have all been, for Marriott have been taken up, but Marriott does have some rooms available. So if you'd like to book rooms, I would encourage you to go ahead and not delay, book as soon as you're able to. If you find that the Marriott rooms are exhausted, we also have a nearby hotel that we've negotiated with, and those blocks will be available to you. So do reach out to Tech Change to discuss that. Thank you. And at this point, I'm going to hand over to the JSI team, Dela, to take us forward with the webinar. Thank you.
Thank you so much, Rose. Hi, everyone. Thank you to the GDHN team for allowing JSI to present this month's webinar. My name is Dela Darji, and I'm going to be moderating today's session. We'll have some team members from JSI sharing lessons learned from the USAID-funded Country Health Information Systems and Data Use Project, CHISU, and then also the Ethiopia Digital Health Activity, the DHA. So these two projects are very prominent at JSI, doing very meaningful work in digital health. CHISU, as I mentioned, is a flagship data and information system project of the USAID Bureau for Global Health. It strengthens host country capacity and leadership to manage and use high-quality health information systems. I'm not going to go into the details, as you'll hear from the speaker shortly, but I'll give you a quick intro. And then DHA is the Digital Health Activity in Ethiopia, a 5-year USAID-funded activity implemented by JSI. This project is helping to build a sustainable, resilient, and interoperable health information system in Ethiopia. So as I mentioned, we'll hear from the great presenters shortly. And next we will introduce our speaker panel. So my name is Dela Darji. I am the digital health specialist at JSI. I have over 8 years of experience in public health informatics, data system management, and monitoring and evaluation. And I currently oversee digital tools and systems for a wide range of projects, from pandemic prevention to maternal and child health. So we have 4 speakers with us today. First will be Steve Ollis. He has over 28 years of experience in program management, digital health, public health, information technology. He currently serves as the project director for CHISU, and which is a project that works in more than 20 countries globally. Next, we have Anya Cushnie. She is an epidemiologist with over 12 years of experience in research, public health, and international development. She's currently the technical co-lead for data use and analysis with CHISU. Prior to CHISU, she held positions in PEPFAR and UNAIDS, where she gained extensive experience through a diverse portfolio of work, specifically to epidemiological research, M&E, and surveillance. Next, we will have Caitlin Madevu-Matson, also from CHISU. She is the lead of monitoring, evaluation, and learning. She has over 15 years of experience providing technical assistance in monitoring and evaluation to USAID, CDC, and HRSA-funded projects in a range of global health technical areas, including HIV, digital health, sexual and reproductive health, and health system strengthening. Then we will hear from Dr. Loko Ibrahim. He is the Chief of Party of the USAID Digital Health Activity in Ethiopia, a $63 million US dollars flagship bilateral project. In his 20 years of public health service, he has managed multiple institutions with annual budgets between 20 million to 650 million, and large diverse teams over 2,000 individuals, while consistently delivering sustainable results and measurable impact in large and complex organizations. So we have a wide range of speakers that we'll hear from today, and I'm looking forward to hearing their presentations. So we'll go ahead and get started. First, we're going to hear from the CHISU team, and then we will hear from Dr. Loko about DHA. After the presentations, we will wrap up with questions and closing thoughts. If you have any questions throughout, please feel free to send them in the chat. We will be monitoring the chat. Otherwise, we also have time saved at the end for questions. So I will go ahead and pass it along to Steve and the CHISU team to start us off. Thank you.
Great. Thank you very much, Dela, for that introduction, and Rose and other co-chairs. Thank you so much to the Global Digital Health Network for the opportunity to present. As Dela said, my name is Steve Ollis, and I'm the project director for CHISU, based here in Washington, D.C. I'm going to give a quick overview and then hand it over to my colleagues for some more details on some of the aspects of CHISU that we'd like to highlight. So what is CHISU all about? Country health information systems and data use. We have a vision. The vision is country health systems in which stakeholders at every level can access high quality data generated from multiple interoperated data sources, and critically to use that data to guide policy and improve resource allocation and service delivery. So these are good words. It's good to have a vision, but what does that actually mean to the clients in the health system? What does that actually mean to the health workers? Well, this means something like, a pregnant woman that can be visited on a schedule that's established by national norms, seen in a health facility that has her history, be referred to a lab for the test that she needs, and receive her medicine at any convenient location. And when she's seen, health workers know her family members and can provide support to them as well. And so how does this happen? This happens through a lot of the technology terms that we're familiar with, through unique identifiers, through EMRs, through interoperability, through data review meetings that are supported through and are able to enable timely allocation of resources, the people, the commodities, the outreach sites we need to provide services, and ensure that data is provided in easy to read formats for health workers, for community health workers, for district and national levels to make annual, quarterly, daily, and hourly plans. So we do this by working across 4 strategic objectives. The first is around health information systems governance and the enabling environment of host country information systems. The second is around systems and software. So it's around increased availability and interoperability of health information systems. The third is everything data, increased data demand and use of health information, data use, data quality, data visualization, analytics, getting into artificial intelligence and machine learning. And the fourth is around strengthened organizational capacity of local partners to sustain the work that's being done in the health information systems improvement. So in everything we do in CHISU is working in partnership with national and subnational level governments. This is now a specific focus on private sector, NGOs, and academia who can provide support both during the life of CHISU as well as after. And then we also are paying attention to cross-cutting issues such as gender and data security. So where are we doing this work? We are a global mechanism. We're working in 26 countries at the moment, providing a really rich opportunity to learn from different contexts. So we're working across 6 continents, from Haiti to Guyana, Serbia, Madagascar, Indonesia, in places with populations of 50,000 to places with over 270 million people, which really just helps to identify those commonalities and see where we can facilitate cross-country learning to see how some of these best practices that are implemented in these different contexts can best be shared. So to do this work, to achieve this vision, we need a team, and there's no one organization that can do everything. And so as USAID's flagship Data and Health Information Systems project, we put together one team that supports this work. The prime for CHISU is JSI, and we also have partners RTI, Vital Strategies, MacroEyes, GemNet Health, and GemB Health Systems, as well as 14 different resource partners around the globe, providing excellence in human-centered design, digital health, and data science. Another key component of CHISU, since we're all about data and being able to demonstrate results, is to be able to ensure that we can demonstrate the results of what we're doing, how we can actually show progression and improvements in the work we're doing in health information system strengthening. And to do this, we use a tool called the SOCHI, or Stages of Continuous Improvement, which allows us to demonstrate progression across some of the key domains that are required to achieve sustainable digital transformation in health. And all of this, of course, is aligned with country priorities and ensuring that not only are we seeing progression of the health information system, but of course, aligning with country priorities to see that progression across the overall health system. So now I'll turn it over to my colleague, Anya, who's going to take us to hear more about data use. And data use is so critical here in everything that we're doing because there's so much focus on the technology and the strategies, and that takes a lot of resource and focus. But if we're not emphasizing the data use, if we're not seeing and transforming the way data is being utilized, then we're really not helping to achieve that return on investment that's needed to actually realize the changes that we need. So with that, I'll turn it over to Anya to take us further. Thank you.
Thank you, Steve. So as CHISU moves into year 4 of implementation, we've been having discussions internally about how are we fulfilling our mandate to increase the demand and use of data. And we have been examining some of what have we learned so far across the project and what can we replicate. So when CHISU started, it was the beginning of the COVID pandemic. So quite a bit of funding that was received was meant to support countries in the management of their COVID-19 data. And so CHISU was really able to use that as an entry point for broader health system strengthening and data management. And so COVID became our way in then to support the increased demand for data and the demand for strengthening health information systems. And there were a lot of lessons learned from that. One of the things we learned is that there's a greater focus needed for data analysis and interpretation. There's been a heavy focus on data quality, which is important, yes, but there's a need to move away from assessing data quality and actually start using the data. And CHISU is very poised to do this because we are not restricted to a particular program. CHISU's funding comes from a myriad of sources. Malaria, we receive funding for malaria, TB, HIV, and maternal child health. And so we're able to learn about data management and data use from all these different programs and bring it into broader health information system strengthening and data use. We are also participating at the national and subnational levels in several countries in technical working groups and data review meetings. And this allows us to be part of that conversation in countries on what are some of the challenges they're having with data use, data management, how are they mitigating those challenges. It allows us to let voice and our support to countries and also to collaborate with partners on their data use strategies. Some of the barriers or challenges that we have learned about so far, there's a need to standardize how data use is assessed. Several countries have been trying to measure data use, and there's a lack of a standardized approach to do this. For example, in Malawi and Indonesia, both teams conducted data use assessments this past year, but they both designed their own data use assessment tools because they had very different objectives in mind. Malawi was more focused on how to measure or how data was being used at the facility level then to make decisions, while Indonesia was focused on how data was being used within specific programs, TB and maternal child health specifically. So they designed their own data use tools in lieu of not having standardized tools to do this. Access to data is also a challenge. We know that data is normally entered or collected at the site level for several countries, but it's really used at the national level. So there's a disconnect then between persons who are collecting the data and persons who are using the data. The collectors of data may not necessarily understand the importance of what they're doing. They're required to collect this data, so they collect it, but they don't see the outputs of what they're collecting, because that feedback loop is weak. Governance issues. We know that governance is a cross-cutting challenge, and it tends to be forgotten when it comes to data management and data use. The governance structures are not in place to facilitate data use and data management. Also, in terms of the information products that are developed, dashboards, the users of the dashboards and the developers of the dashboards are rarely sitting in the same room together. So when these products are developed, you don't have that coherent discussion happening. And so the users aren't happy about the dashboards. It's too complicated. The developers have other ideas in mind. So it's important that both of these persons are sitting in the room together when information products are being developed. There's also the challenge of capacity, and this is a significant challenge, the capacity to use the data, to analyze the data, to interpret the data. And countries are facing this with their limited human resources. So having understood the challenges, we've been asking ourselves several questions. How can we take what we've learned and make an impact then with regards to improving data use? And one of the questions, several questions we're asking is, what are the interventions then that are being used for countries that we can prioritize? What are some of the interventions that have contributed to improve data use and data interpretation? How can we replicate those practices in other countries? Measurement of data use remains a challenge. So how do we prove that we have improved data use? We're looking at developing standards to ensure that they're a solid foundation for data use. Instituting data use surveys then, where we're talking to the key informants and stakeholders in countries to determine what are the best practices that they have developed and used in their countries to improve data use. Promoting improved data visualization. Also looking at the role of AI and automation of data visualization. You think about the health sector, one of the challenges is limited human resources or high turnover of staff. You train staff and then in 3 months they leave. And that's always been an issue. One of the strategies then would be to use AI or to automate the processes in lieu of limited human resources. We're also looking at promoting more non-traditional methods for measuring data use. CHISU has started scoping web access metrics. So looking at how we can use metadata then to assess how dashboards are being used. Surveys and case studies also, more qualitative ways of measuring data use. Also supporting the tools to increase data use, dashboards, bulletins, and advanced analytics with mathematical modeling. So these are just some of the examples of how we are trying to move the needle then on improving and increasing data use across the country portfolio for CHISU. I'll hand over to my colleague Caitlin now, who will take us through our gender focus.
Thank you so much, Anya. Good evening, good afternoon, good morning, everyone. I am Caitlin Madevu-Matson. I am going to talk to you a little bit today about how we are integrating gender into all of the work that we do at CHISU. We have a comprehensive gender plan that really helps us think about how we institutionalize gender across all of the strategic objectives that Steve shared with you. We really make sure when everyone starts on our project that they receive a gender orientation to think about being aware of gender in all of our work, but also how we integrate it into our daily and weekly and monthly activities. We also have a gender advisor who helps to provide an external eye and help us all think about how to be creative and innovate as we're integrating gender. And then we're also really making sure that we're tracking what we are doing, and we report on those gender activities on a quarterly basis. In addition, the SOCHI framework that Steve shared with you, the Health Information Systems Stages of Continuous Improvement, that framework actually has, I think, 5 or 6 different areas where gender is baked in to being able to progress along that maturity model for a country's health information systems. And so those benchmarks that are there really help to promote not only us and those of us who work for CHISU, but also the countries that we're working with and trying to help them progress their national health information systems and the maturity of those systems. It really helps us have those conversations with them to promote awareness and think about how they are integrating gender into all of the work across the different domains of SOCHI in the country. In addition to integrating our gender activities into the work that we are doing across all of our technical assistance in the various countries and regions where we're working, we also have some global level work. We're really trying to advocate for broader integration of gender into health information systems and digital transformation globally. Our project director, Steve Ollis, is the co-lead of the Digital Health and Interoperability, Gender and Diversity, Equity, and Inclusion Small Working Group. We are participating in numerous conferences. I don't think I even captured all of them here, but we're really trying to present on our experiences with gender in health information systems and digital transformation. We're really trying to promote International Women's Day as a digital transformation lens on that, and trying to hold different webinars and really also contributing to the African Women in Digital Health flagship initiative action plan. Now back to particularly thinking about how we help our own activities integrate gender into all of our work. After we originally developed our gender plan, we realized that thinking about integrating gender in theory was perhaps a little bit kind of easy and accessible for people, but those kind of tangible examples of how to do it on that day-to-day, week-to-week basis, we felt like we needed a more hands-on guide for that. And so our fabulous gender advisor developed a gender considerations guide. And this was really pulling from our technical approach, but provided a menu of really clear options and available kind of ways that we can consider gender and really apply it with our work. This guide is tailored to the technical work that we're doing and really just provides these suggestions. And then in our ongoing calls and discussions with each of our teams, they get to kind of think through some of these suggestions and think about which ones would be relevant for their country context and also the technical work that we are doing in that country. And so here are some really great examples of some of those considerations and how they've been applied across some of the different countries and regions where we are working. But also you can see here on the screen in the different colors across our different strategic objectives. So we're not simply disaggregating data and thinking about making sure that anytime we are analyzing data, we are showing kind of how many men and how many women received certain health services. That is incredibly important. And you can see kind of some examples of that kind of work in the data quality and use in the bottom in green. But we're also more than simply encouraging and advocating for disaggregation during analysis. We're also trying to think about gender sensitivity during workshops and trainings, trying to make sure everyone is really always thinking about gender and how the gender digital divide could affect how people are using the different digital tools we're supporting. In the top right, in the brown, you can see in our systems and software strategic objective area, we're working to really think about when we're developing new systems, making sure we're actually capturing the data in the right formats to enable those kinds of analysis that happen on the other end, and really making sure that those standards to support analysis of gender and sex disaggregated data are really included in all interoperability guides and approaches and policies. On the top left in blue, we're working in governance. We're really trying to make sure that gender is being brought into every single policy and protocol and standard that we are writing. And thinking about when we are writing our own job descriptions or helping the government country where we're working, helping them think about developing their job descriptions and making sure that gender is an important component of all of our work. And so, you know, I mentioned we're tracking all of these things on a quarterly basis at CHISU. And so in our most recent quarter, we're now tracking 105 different gender considerations across our 14 currently active countries and regions. And so you can see on this graph that not only is the number of considerations increasing that we're tracking, but really importantly, we're observing an increase in the share of the considerations that we're tracking that belong to our data quality and use work in green, in sort of the middle part of the graph. And this is really showing our emphasis on integrating gender into our HIS work, our health information systems work, and how we see that as a really important mechanism to improve data use and better decision-making, and really making sure that gender is an important part of all of that. So looking ahead, I hope that you can see that, CHISU is really paying attention to gender. It is so vitally important to digital transformation. And we're using our global platform to advocate for this with other partners and projects as well. We are systematically integrating gender in HIS. We're doing it on a really large scale. And we're measuring it. As our monitoring, evaluation, and learning person, it's very important that we're actually measuring it and learning from those tangible examples of what we are able to do. However, we are still seeing a gap in measuring the impact and change that we are seeing from this gender work. So we're now exploring how to go even further. And so we're working right now on a gender tiers framework, which is something like a maturity model for gender integration. And so this gender tiers framework really places those example gender considerations that we have in that consideration guide I showed you in a few slides ago. It places those considerations on a continuum that moves beyond simply systematically monitoring them and really tries to provide a path for our teams to see progression in the ways that they are integrating gender. And we feel that this gender tiers framework will help us better measure the impact of this work of integrating gender. So we're really excited to see where that goes. And we will be very happy to share all of that information with you and also answer your questions. Thank you. Back to you, Dela.
Thank you so much, Caitlin, and the rest of the CHISU team. I know we have some questions coming in the chat, so we will get to them at the end. We will have our last presentation will be Dr. Loko presenting on the Ethiopia digital health activity. So I will hand it over to you, Dr. Loko.
Thank you very much, Dela. Thank you very much, Global Digital Health Network, for the opportunity. So I'll be presenting lessons learned by the digital health activities implementation in Ethiopia. So the digital health activity, we're just starting our 5th year. We've been in operation for the last 4 years. So it's a 5-year project. We're supporting the health sector to achieve its information revolution roadmap. This is an overarching, it includes an overarching objective of meeting the data needs of the health sector's leadership and the frontline health workers working at the community health centers and hospitals. We also intended to build the skills required to improve the health and well-being of all Ethiopians by using the data for decision-making, data generated from the different information systems that we're supporting the country. So we have a national presence. We basically work in all regions and city administrations in Ethiopia. While we focus on information revolution, health information systems, the benefits, the dividends go well beyond health information systems. We have, as I said, our overall goal is to improve the quality of life of Ethiopians through enhancement of health service quality and health outcomes. We have 4 objectives. The first objective is support information technology systems and data repository. So we help in the co-creation, design, development, deployment, and scale up of different digital tools, which are used at point of care, at the community level and health facilities. We also support health information systems tool, which are used to collect data, analyze it, and use it for decision-making at point of generation and higher up at the national level. Our second objective is building the culture of data use and improve service quality. We also support capacity of health professionals, build systems to improve data quality and improve services. We also work on governance. We all know that governance is foundational. It's extremely important that visions, strategies are well laid out, and there is joint investment on these platforms to achieve the bigger goals of improving service quality and health outcomes. And as you know, in the last 4 years, we had COVID as a pandemic. We've been actively supporting the health sector to track clients, to disseminate information, have learnings, and track clients benefiting from vaccine, and use that information for decision making. We sort of tried to narrow down the learnings. Of course, there are so many things that we can talk about the learnings and the challenges, but we've just picked few. So we think that coordination, co-creation, and having a local leadership is extremely important if any digital transformation agenda goal is to be met. Expanding the role of private partners, local partners, and actually make sure that they are on the table when decisions are made and they are active players in the deployment, capacity building of healthcare professionals at all levels. So I've been working with private partners, investors in use enterprise. I'll briefly describe what that means. And we also know that it's extremely important to be flexible and agile. So no one thought about COVID, and we are having still conflict. So it's extremely important that you create a system which responds, a data system, an information system which responds to the ever-changing needs of the health sector, also ensuring sustainability as well, and resilience during emergencies, including conflict. The other one is to strike the right balance between the different facets of our objectives, which include digitization, data use, and capacity building. It's extremely important that the interventions evolve during the course of the implementation so that the bigger goals are achieved. And finally, it's extremely important when we design intervention, we need to have, it should be person-centered and should be community tailored as well. So I will go, as I said, it's extremely important to have a country leadership. So that's why we've been actively supporting the government of Ethiopia to develop the different strategies and policies. Some of them have already been there. It's extremely important that you consult the national strategy so that whatever you invest in is sustainable, outlasts any particular projects. So Ethiopia has a digital health blueprint, which clearly outlines what systems are needed within the health system, what capacities are needed, how they are integrated, how do they talk to each other, and what decision support mechanisms should be availed, as I said, at all tiers of the health sector. We've also been very active in developing the information revolution roadmap, which integrates digital health or digital solutions, data systems, and use at all levels. Additionally, these documents address the governance need and also the capacity required at all levels. So I think the biggest lesson is extremely important that all interventions are aligned with the national priorities, and partners should be very active and be on the table when these documents are designed so that they are sustainable, result-oriented, and respond to the needs of frontline healthcare workers, and national leadership. Previous slide. Yes, so expanding the roles of private sectors, investors, enterprises, the digital health activity has been intentionally engaging with the local universities. We have six of the big universities in Ethiopia, which are actively supporting all the digital tools, data use interventions, and as well as the capacity building. The matrix that you see here shows how their involvement, the industry, academia linkage actually influences decisions and impacts all the facets of data use and information systems. We've also been working with the use enterprises. This has multiple impacts. It creates motivation and job opportunity for the use. They provide ready-made support, very accessible support to the last mile healthcare providers and health institutions. And as well as we believe that they are the upcoming leaders of digital health. So it gives them the opportunity to know what's happening, create innovative ways of doing, design work, development, and scale up. So in a way, we are nurturing the next generation leaders in digital health and digital transformation. We have 17 of them, as you see, distributed all over the country, and supporting the health information system and all digital applications and platforms that are out there for the health workforce as a community and health facilities level. The lesson here is all intervention should be embedded to local partners, and their capacity should be nurtured while all creative, well-tested interventions are implemented in countries. The other lesson is as you know, majority funding for projects comes from programs, from malaria, TB, HIV programs, maternal and child health programs. Health information system, as you know, is one of the building blocks of WHO. We intend to build health systems which responds to the need of the service delivery. So it's extremely important to balance the need as a service delivery level, program level, and the overall health systems enhancement at national level. As you can see from this schematic, our interventions address the health systems layer. For example, we work with our partner IntraHealth to deploy integrated health human resource information system, which manages the health workforce within health, and that directly responds to the need for human resources for health. With that platform, we've seen an increase in availability and also managing the competence and efficiency of the health workforce. On the product side, we've been actively working on ELMIs at all levels of the health system so that we assure quality of products, their availability and affordability to the community. We've also been working slightly on the health financing system, which is extremely important for the leaders to do proper resource allocation and management. Ultimately, it's about decision support for the leadership and governance. All these different platforms, data systems should come into one platform, which helps the decision-making process at national and subnational levels. And as you see in the inner layer, we've been working to address the needs of the service delivery. Sometimes we produce dashboards, we produce platforms to relay data which could be used at higher levels for decision making, but it's extremely important that tools, data intervention, capacity building also addresses the service delivery layer. And we've been supporting the government to develop point of care applications like electronic community health information system for the community health workforce. And we have prototyped electronic medical recording systems which can be used by health centers and hospitals. And with that support, we are seeing increased efficiency in terms of results, turnaround time, stay as outpatient, improved health outcomes. We've seen a decrease in mortality in the facilities and also increased responsiveness of the health system. There is electronic referral between community health workers and health facilities, and that facilitates the care and also risk protection. So whenever we do interventions, be it digital health, data, capacity building, it should be responding to the needs of the healthcare leadership and as well as to the most important workforce within health, which are the frontline health workers. So balancing the two needs while responding to the program needs of the donors is extremely important. The other one is the flexibility and the balance. As we continue to implement transformative digital interventions, digital and data interventions, it's important that your implementation evolves. When we started the project, we started with heavy digitization practice because tools are in their early stage of customization, some of them not even developed. And we also focused on data use interventions. I mean, a little bit of capacity building and sustainability interventions. But as we evolved, starting, say, mid-project, majority of our interventions shifted to primarily data use, using it for decision-making, making sure that capacity is built for both pre-service health workforce joining as an industry, and also continue to customize, mature, and integrate the different digital tools. The schematic that you see on the left side describes how our interventions evolved over the years. The other one is the flexibility and agility to respond with COVID, and particularly conflict. What we've learned is even if you have robust information systems and digital tools, it just takes a few weeks of conflict to actually wipe out all previous investments, including data. So we've been thinking on ways of moving the data ownership to the clients. And we're now deploying a system whereby individual clients have their data with them using smart cards that you see on the right lower corner. This is progressing quite well. We've started with COVID vaccination and EPI clinic individual data tracker, but the plan is to expand this to a wider healthcare system. So it's extremely important to be flexible, to respond to the country's needs, and make sure that systems are resilient. They even outlast conflicts and natural disasters. And with the conflicts that we have, what we learned is even if you have a robust system, it could be wiped out with conflicts, and you lose significant amount of critical client and national data. So that's why it's important to push data to the rightful owners of the data, who are individual clients. The other one is, at the end of the day, you need to respond to the so what question. So we're doing all these interventions, and how does it respond to individual clients and frontline healthcare workers? So we designed an intervention so that clients could actually benefit from the interventions and value the interventions, develop the ownership, and actually request for digital investments, not the other way around. And as well as show the benefit to the service providers, how it makes their lives easy and decision well thought and backed with information. So the point of care application tools that we use are interoperable, integrated, and could handle claims right from the community level through the community health information system to primary health centers and hospitals and back to the community. Additionally, we built in notifications so that clients exactly know where their appointments are, when they have to go to clinics to pick up their medicines, and when their next care cycle is. So this has been very helpful and has been well received again by the rightful owners of all these interventions, which is the populace of the community. So at the end of the day, all our interventions are anchored to responding to the question of how are these impactful to the community and individual clients in the country. Yeah, that's what I have. Thank you very much for the opportunity. Happy to respond to questions. Back to you, Dela.
Thank you so much, Dr. Loko, for presenting for DHA, and then also the CHISU team for presenting. Those were really thorough and insightful presentations, and we had some great conversations in the chat too. So we really appreciate you presenting. In the interest of time, I think we've answered most of the questions in the chat, but I think there's one follow-up question that we will continue to address in the chat. I will go ahead and close out with our rapid fire for our panelists. So I had just wanted to do a quick rapid fire question to all of our speakers. So in one short sentence, If you were to go back and implement this project all over again, what is something that you would change? And Steve, do you want to start?
Sure, I can go first. All right, I'm going to take 2 sentences. First, I think for us would be to not start during COVID. That was definitely quite a challenge. But I think in seriousness, what I would do is we focused a lot on being able to demonstrate and measure health information systems progression at a high level. And I think it is also important to be sure to demonstrate that progression on a micro level and very personal level. So for example, in Indonesia, we've been able to recently demonstrate that thanks to foundational investments in enterprise architecture and interoperability, that a health worker seeing a TB client has had the time they need to spend on record keeping cut in half. And to be able to then have stories like that that make the compelling case for health programs to continue to invest and funding partners to invest in these foundational investments. Thank you.
Great answer. Yeah, it wasn't convenient starting in COVID, but you guys handled it really well. Dr. Loko, do you want to go next?
Yeah, so I think the next cycle for us would be great because digital health activity is the first bilateral, very big integrated digital health activity. I would have liked to build on some similar predecessor. As Steve said, COVID was a major disruption, not only because of our implementation, but in terms of gaining the attention from the leadership. I think what we will do for DHA2, or if we have to restart for DHA1, would be to recruit as much local partners as possible so that we have proper local leadership. So as many universities as possible, as much youth enterprises as possible, so that we make sure that's even more locally led going forward. Over.
No, I think that's really important. And I think we heard about the local leadership and involving the local partners from both projects. So I think that's a critical piece for any project. So I appreciate you mentioning that. Caitlin?
Thank you, Dela, and thank you, everyone. I think from a gender perspective, we're incredibly excited about the amount of work that we are getting and examples we're seeing from our teams. They're being so insightful and thoughtful in the ways that we are integrating gender. But I think I mentioned to you, I don't think we were able to even see ourselves at the beginning, this idea of progression even within gender. And you start at step 1. If you've never really been able to incorporate gender before, how do you begin that process? But maybe those of us who are already in step 1, we're ready to move to kind of another level, something a little bit more nuanced. And maybe even more intensive. I think that's something we're working on now, and it could have been useful to have that a little earlier on. But we're excited to learn about it now. Thanks.
Great, thanks. Yeah, I'm looking forward to seeing all of the work that you're continuing to do with gender, as I think it's really critical in our time. All right, Anya, the last one.
So I think from a data use perspective, we are really excited and encouraged by the work we're doing around interoperability. I think we've seen where countries see the benefit of interoperability for reducing their workload and also increasing the demand and the generation of data and the use of data. And so CHISU's supporting, interoperability between different data streams. I think we're very encouraged by that. Yeah. And that's something we're pushing going forward.
Thank you so much, Anya. And thank you all to all of the presenters, all of the participants. We really appreciate you participating and engaging. And thank you again to the Global Digital Health Network team for allowing JSI to present on our projects. If anyone else has any questions, feel free to share. I think we may have like a minute or two before I hand it back over to Rose to close out. I think we had one other question. What is the stage of implementation of EMR in Ethiopia hospitals? Dr. Loko or Biru, do you want to quickly answer that in person or in the chat?
I can take this one, Dela. Can you hear me?
Yes. Yeah, go ahead. Thank you.
Yes, thank you, Dela. So Ethiopia has been doing a lot of job in implementing and adapting and implementing AMR. And we have an open source global code open MRS tool, and we are currently implementing at large through the USAID Research Activity DHA, but the ministry and facilities themselves are taking the lead to also expand at these facilities. And yeah, it is an on-shelf system customized for all types of health facility, and every facility is taking the lead to implement this. So this is the state we are in currently. Thank you very much.
Great. Thank you so much, Biru. And thank you all again. I will pass it back over to the Digital Health Network team.
Thank you so much to the JSI team for an amazing presentation. I really enjoyed it. I've learned a lot, and I hope everybody that has participated has. So this is a thank you to the panelists from CHISU and DHA. Thank you for putting together an insightful presentation. I want to thank as well Kari for coordinating and organizing us as we prepared for this webinar. And thank everybody for participating. And I look forward to seeing you all in GDHF 2020, those that are attending, both in person and virtually. Thank you all so much. Please do remember to sign up for GDHN if you haven't signed up already. The link will be provided on the slides, and as Kari said on the chat, you will find the slides available on our website. Thank you.